everybody! So I'm really excited to bring you this video today about the 8 different nurse practitioner specialties, and I want to really dive into what kind of patient population each specialty will care for and what a typical work environment they would be in. This will really help you understand what your future career as a nurse practitioner could look like. So if you haven't watched one of my videos before, my name is Caitlin and I've been a family nurse practitioner now for 2 years. And I was a registered nurse in the hospital for 6 years. I gotta interject here because while editing this, I realized how much material this is. And you know, sometimes it gets a little overwhelming when there's so much information being thrown at you. So stick with me through the video because I interject here and there with different information that's important for you to know about the specialties. And then at the end, I give you my own personal advice that I wish I knew when I was advancing my nursing career. So let's get into the 8 nurse practitioner specialties. The first one I'm going to talk about is a family nurse practitioner. This is what my nurse practitioner specialty is in. A nurse practitioner can care for anyone from birth to death, and they typically work in office settings. So like I said, I am a family nurse practitioner, and the reason I made this decision is because I knew I wanted to get out of the hospital, and I wanted a more normal life schedule. So I knew working in a primary care office setting or an outpatient office setting would be able to give me that more normal life schedule. So this is why I made this choice. Second is an adult gerontology acute care nurse practitioner. This is a nurse practitioner who typically cares for patients that are 18 and older in an acute care setting such as a hospital. I will say that there are states with different rules that sometimes these nurse practitioners can take care of patients that are in their teenage years, but it really varies state to state. The third kind of nurse practitioner specialty is an adult gerontology primary care nurse practitioner. This is similar to the one we just talked about, except now in a primary care setting. They still care for those patients that are typically 18 and up, but now you're going to be working more like a family nurse practitioner would in an office-based setting. Okay, I have to jump in here and tell you something. So we just went over the gerontology nurse practitioner specialties, and there is an acute and a primary. But now we're about to go over the pediatric specialties where there is also an acute and a primary. And I want to point this out to you because these distinctions are really important when choosing your own specialty. So stick with me, and after the pediatric specialties, I will then explain further. Your fourth nurse practitioner specialty is a pediatric nurse practitioner in the acute care setting. This cares for patients from birth through 21 years of age in a hospital setting. Your fifth kind of nurse practitioner specialty is a pediatric primary care nurse practitioner. Same as the last nurse practitioner, except now we're working in a primary care setting with those patients that are between the ages of birth and 21. Okay, so we just went over those pediatric specialties, which also has the acute and primary like the gerontology. So what I wanted to point out to you was both of these specialties, the 2 gerontologies and the 2 pediatric, so each have their group that they take care of. So gerontology typically does adults and peds typically does children, but they each have the subspecialties of acute and primary. Acute meaning more hospital-based, emergency-based, and primary meaning more chronic health conditions, things that can be handled outside the hospital. I want to point this out because it's very important which one you choose. I chose primary care so I could do all ages, so I wasn't stuck with just adults or just with kids. I thought it wouldn't limit my job opportunities, so I decided to do family. But since I did family, I am only able to really work in primary care settings and not hospital settings. So they're really starting to phase out letting you cross over and do both in rural areas, and in some places they still will because they have to take what they can get. But overall, this is a very important decision because it's really going to put you into that area that you can work either hospital-based or not hospital-based. So you really have to think about what you want to do with your career, because if you decide to change later, most likely you're going to have to go back and get a second specialty so you can work in both. It's about 1 more year. So if you already are a nurse practitioner and you want to go back and be dual certified in another one, most programs are typically about 1 more year, which includes clinical time. So now we're jumping into our last 3 nurse practitioner specializations, And I kind of just want to give you a heads up. These three are very specialized in their own way. So really pay attention, and I will explain more afterwards. The sixth kind of nurse practitioner specialty is a neonatal nurse practitioner. This kind of nurse practitioner will work with babies from birth until about 2 years old that are in critical situations. So they will work with babies that are in the emergency room, in the delivery room, in the intensive care unit, and then they can follow these children through the age of 2 if they have a long-term illness. So these nurse practitioners will work in hospitals and maybe some outpatient clinics when they follow through with those children. The seventh nurse practitioner specialty is a women's health nurse practitioner. This type of nurse practitioner cares for women of all ages. They typically will work in office-based settings and will do lots of different things with women, from preventative health screenings to menopausal care to postnatal care. And the eighth and last type of nurse practitioner specialty is a psych mental health nurse practitioner. These nurse practitioners work with people, obviously, in the psychological and mental health field. Psych mental health nurse practitioners typically work in office-based settings, but some will work in hospitals if there's an emergency situation. So here your work environment can really vary depending on what you want to do. So these last three groups of nurse practitioner specialties that I talked about, the neonatal, the women's health, and the psych mental health nurse practitioners, these three specialties are very specific. So if you choose one of these three career paths, you really want to be passionate about it, and this has to be something that you really want to do. Because if you choose to go be a neonatal nurse practitioner, you can only care for kids in emergency situations from birth till about 2. So if you decide you want to then work in the hospital with kids but do something more diverse, you would not be allowed to go work on a generic floor taking care of kids that are 5, 6, 10, 12. You're just not going to be allowed to do it. It's going to be outside your scope of practice. And the same with the women's health and the psych mental health NP specialties. Your patient population is going to be very specific. So in these three specialties, your environment, I feel, is not as important, because if you choose one of these three tracks, it's more that you really want to work with these specific patient populations. So if I had to give advice to a current nurse or a future nurse, man, there's so much that has changed since I went into nursing school. So first, my advice is expect change. There's always change in healthcare. Things are always evolving. So accept that and just know that you can make plans about your career and what you want to do, and that there might be roadblocks and there might be changes along the way. And the quicker you accept that, I think it just makes things easier. Also, if you are a current nurse, my advice to you is to really think about, do you want to work in the hospital forever, or do you want to get more outpatient? What kind of patient population do you want to work with? If you currently work in a hospital where there's only adults, and you've always dreamt of working with kids, and you think you want to be a pediatric nurse practitioner, then you really need to get out of there and get a job with kids. Because one, you're not going to get into a nurse practitioner program for kids if you have 0 hours of experience with children. Secondly, you need to know if you actually want to work with children. There are a lot of people who say that and then they go and do it and they decide, never mind, this isn't for me. So that is my advice to you if you are currently a nurse. If you're thinking about becoming a nurse, then my advice to you is that your nursing experience does matter. You want to be a neonatal nurse practitioner. Well, you need to get a job as a registered nurse with neonatals, at least in a pediatric hospital where you can move into a position where you would then take care of this type of patient. Thank you guys for sticking through this video with me. I know it's a lot of information and material, and it's kind of a difficult topic to discuss because choosing your nurse practitioner specialty really shapes and forms your career. It really molds where you can work and who you can care for. So I hope this video on the 8 different nurse practitioner specialties is helpful to you. I know I wish I had some of this information given to me when I was choosing my nurse practitioner specialty. But if you think about the things I told you to question and think to yourself about, then I know you'll make the right decision. And hey, remember, you can always go back to school and be dual certified. Have a good one.